I'm Will Parsons, and I'm a pediatric oncologist at Texas Children's Hospital in Houston, Texas. Pediatric brain tumors remain one of our biggest challenges. So in terms of cancers that kill children, they're right there at the top. And one of the keys to treatment is being able to do an effective surgery and remove as much of the cancer as possible, and ideally all of it. But for pediatric brain tumors, even though the surgeons do incredible things, they can't always do that, right? The tumors will be in parts of the brain that a child can't lose, so it can't just be taken out. They'll be in parts of the brain where doing a surgery will cause a lot of challenges for them in terms of all normal functions of what they'd like to do in their life and when they grow up, and so it can be a real challenge. So the inability to do complete or very complete surgeries is one challenge for pediatric brain tumors. Another is your brain and spinal cord are so important to each of us that our bodies have evolved mechanisms for keeping anything bad away from them. We have what's called the blood-brain barrier, where it's a coating and just a system that basically is designed to protect your brain and spinal cord from anything getting in there that should not be there. Unfortunately, when we're trying to give a treatment for a cancer in the brain, that's something that the body thinks should not be in there. And so there's other kind of biological and practical challenges. And then I think the third reason they've been hard to treat is that we've not understood that much about their biology and their genetics, and that's where there's been incredible progress over the last 10 to 20 years. So there's a lot of reasons that brain tumors are hard to treat. The exciting parts of this has been that since I was first in training, there's just been a revolution in terms of our understanding of the biology and the genetics of almost all of the different types of pediatric brain tumors. A lot of this aided by new technologies of the last couple of decades. So for example, the ability to sequence the entire genetic code in patients or in their tumors has allowed us to get a real understanding of what kind of the genetic landscape of all the things that can go wrong in a pediatric brain tumor, and has allowed us to much more effectively classify them. What we used to call all medulloblastoma, for example, now they have different subtypes of the sonic hedgehog pathway activated medulloblastoma, or other types. And they each have different biology to some extent. They each have different prognoses, actually. Some of them we can treat very effectively, and now we just have to figure out how to do it more safely, and others we just don't effectively treat. So there's been incredible progress in terms of understanding the biology and genetics of brain tumors, which has allowed us to more effectively or more precisely classify them. And also all sorts of new therapies are being devised and tested in trials targeting those specific kind of biologic and genetic features.